talk titled Whose Ethics? Embedding Public Participation in AI Governance. So Aidan Peppin is a senior social scientist at the Ada Lovelace Institute, which was established in 2018 by the Nuffield Foundation with a focus on ensuring data-driven technologies guarantee benefits for society. So in his key role as researcher, Aidan's project spotlights the social and ethical issues of health data and technology, with a strong emphasis on public engagement. Through his recent mixed methods research, Aidan and colleagues have produced two important reports at the Institute. The first is from the Citizens Biometrics Council project, and the second from the Data We'll See Now project. These reports highlight public deliberation on biometrics technologies, such as facial recognition and fingerprinting, and explore the datafication of health, respectively. So if you haven't done so already, I recommend adding these reports to your research reading list. If it helps, I will leave links to these in the chat for those interested. So without further delay, I would like to invite Aidan to begin his talk.
Thank you so much, Nisha, both for the introduction, but also for the invitation to come and speak today. Really glad to have the chance to kind of share the work we've been doing at Ada with you all today. So let me just bring up some slides to hopefully help me speak through the points I'd like to make. And yeah, really looking forward to kind of your questions that you have towards the end. So as Nisha says, the topic I'm going to talk about is kind of this question of public participation in artificial intelligence, but also in the data sets that underpin artificially intelligent technologies or AI technologies more generally. And really, I want to kind of the thing I want to pick up, the question I want to pick up in this talk is the fact that there's a huge amount of focus, as everyone on this call I'm sure will be aware, on ensuring AI is ethical. Now, aside from asking what do we mean by AI and what do we mean by ethical, the thing I want to pick up on really is, as Nisha says, this question of whose ethics and underpinning that, whose values, whose needs, and the question of who matters in terms of how we determine and define what is ethical or well-governed or responsible AI is really important.
Public opinion in
the Institute. And the work that we do and the work that I'm going to talk about today is all about embedding public participation into questions of policy, governance and ethics in relation to data and AI. So I'm kind of hoping to cover three things in this talk. First is to briefly tell you a little bit more about the Institute, just to give you a bit more background context about the perspective from which I'm speaking. Second is to talk about the main topic of public participation in data and AI, and outline some of the concepts that underpin our thinking around public participation in AI, and also some of the projects that we have done off the back of that work, including the ones Nisha's mentioned. And then I want to kind of wrap up by diving a little bit more deeply into two specific projects that I think might be interesting. One is a public dialogue on location data, which we supported. Now, I appreciate location data might not be the topic that everyone on this call is immediately drawn to and knows is particularly interested in, but I wanted to use this as an example of how some of these methodologies of participation can look in practice. And then the second project I want to talk about is algorithmic impact assessments, which maybe hopefully is more directly relevant to many of the topics that you work on, and is a project that we developed alongside the NHS X team in NHS Digital, and which I'll talk a little bit more about towards the end. So that's hopefully what I'm going to cover. So let's start at the start and tell you a little bit more about the Ada Lovelace Institute. So as Nisha says, we're an independent research institute, and our mission is to make data and AI work for people and society. And what that mission roughly means in plain English is we conduct a range of social science, humanities, legal, policy research around the impact that data and AI technologies have across society. And we do our best to build the evidence case around how we can ensure technologies are less harmful and more beneficial. And again, as Nisha said, we were established in 2018 by the Nuffield Foundation, and Nuffield remain our parent organisation and core funder, but they established us with the organisations that you see on the screen there. And we're really lucky to have good connections and links still with all of these organisations, and we work closely with them on many of our projects. And we're really fortunate to have their involvement in our work. Briefly, just a quick mention about who Ada Lovelace was. Now, hopefully she's familiar to many of you already, but for those who are less familiar, Ada Lovelace was a 19th century mathematician, and she wrote an algorithm for Charles Babbage's analytical engine, which is widely regarded as one of the kind of early kind of forerunners to modern computers. And that means she's widely considered the first ever computer programmer. And for many, she also stands for the role of marginalized people in the past and present of computing, not least because she was a rare woman working in this field all those years ago, but also because her contributions were largely overlooked. So the algorithm that she wrote was actually largely in a footnote to one of Charles Babbage's paper, which the footnote ended up being longer than his original paper, and it largely went unnoticed until about 100 years later, when Alan Turing kind of picked up on it and recognized it for kind of the important work that it was. Now, I'm going to caveat all of that by saying that we are not an institute that spends a lot of our time researching her history, and that's probably a very potted history, and any historians in the room might question some of the details or probably add some nuances that I don't have. But I wanted to introduce her because there are very few institutes in the UK named after women, let alone technology-based institutes named after women, and that it's really important aspect of who we are as an institute, that we are ensuring that people who have been historically marginalized are heard in the modern day debates around data and AI. And she's just a really cool person. If you look at her history, she was a very fascinating person. Anyway, enough about Ada Lovelace. I'll tell you a little bit more about the work that we do at the Institute. So broadly, our work falls into three categories. Convening diverse voices, which is all about bringing together different professional, disciplinary expertise and experience, but also lived and public voices and perspectives into debates and conversations about policies relating to data and AI. So this manifests in a lot of the participatory work that I'll talk about in the kind of bulk of this talk. But also we do a lot of things like convening roundtables with various disciplinary backgrounds, so that when topics like how do you responsibly deploy Bluetooth contact tracing apps, when those topics arise, we can kind of try to get the right heads in the room to discuss that. The second part of our work we call building evidence, but really it's bread and butter research. And as I mentioned, a lot of this comes from a kind of social science and humanities lens, but we're quite an interdisciplinary team. We have people with legal backgrounds, people with policy backgrounds, people with social science and humanities backgrounds like me and my colleagues in the public engagement team. But we also have people who come from a much more technical background and have experience with kind of software development and AI technologies directly. So we try to kind of bring all of those different perspectives together to use a range of methodologies to just understand the kind of impacts of data and AI on society and find out ways that we can hopefully ameliorate them. And most of what these first two activities do contribute to our third activity, which is shaping and informing good policy and practice. So the idea is that we're building the evidence base and we're bringing all these diverse voices together so that those who are developing policies about data and AI, who are governing these technologies or regulating them, and indeed who are making them, have as much evidence as they can have to try and ensure that they're doing so in ways that are generally better for society. And I appreciate what better means, what society means, all these kinds of questions and all these very broad terms that I've used, and any philosophers in the room will pick me up and want me to define those better. But that's a talk for another time, I'm sure. But generally we do research and we try to influence policy and practice with it. And our research falls across these 5 programs, and I kind of introduce them here not to go in great deal of depth around any of them, but just to give you a sense of what it is that we're currently working on at the Institute. And a couple of them are self-explanatory, biometrics, that's facial recognition technologies, health data and COVID-19 technologies. That's many of the digital systems that have cropped up and AI-driven systems that have cropped up in the last couple of years in response to COVID-19. So we're very interested in the impact of those. Public sector use of data and algorithms is all about how local authorities and central government and other public bodies use algorithms in their everyday work. Future of regulation is very much that. We're interested in the various policies, legislation in the UK and across the world, and what they might look like. Many of you will possibly be aware that UK government is currently thinking about what the future of things like the general data protection regulation look like for the UK now that we're outside of the EU, and we're really interested in making sure that whatever it looks like, it's underpinned by a really robust evidence base. And then lastly but not least, ethics and accountability in practice work, which is very much about taking the principles that you often hear around ethical AI, or indeed the concepts around good governance, and thinking about what do these things actually look like in practice. So that's where many of my colleagues with technical backgrounds work. So as I say, I give you this overview of the Ada Lovelace Institute, not to dwell too much on it, but just to give you a bit more perspective of where I'm coming from and where the work I'm doing sits. And the kind of shorthand I describe in terms of where I am in the landscape is, and where the Institute is in the landscape, is somewhere between the worlds of academia, policy, civil society, and industry. I don't think we neatly fit into any one of those categories. We perhaps sit more neatly in some of them than others, but we're trying to create connections among those different areas. So on to kind of the main thing I want to talk about, and the sort of indirect answer that I give to this question of whose ethics. And that's to talk about public participation, data, and AI. And the work that we're doing on this broadly falls across 4 categories, and I'll dive into a few more of them in detail as I go through. But the work we do is partly your kind of bread and butter public attitudes research, things like surveys and focus groups to understand what people think and feel about technologies, what their experiences are, and kind of gather evidence around that presented to policymakers and practitioners. We also do a lot of public deliberation and dialogue. So the Citizens Biometrics Council that Nisha mentioned is one of these kind of flagship projects for us, where we don't just ask the public what they think, but we bring them together and we give them evidence and information about various AI-driven and data-driven technologies. We bring them experts that work in the field, and we give them a lot of time to get to grips with that information, to develop informed and almost expert opinions, but also bring their own lived experience, and then ultimately do things like make recommendations about how they think these technologies should be governed. We're increasingly doing more kind of participatory ethnographic methods. So one of my colleagues is working on a project to hand the research activities over to participants themselves. So we're going to be working with members of various communities up and down the UK to ask them to conduct their own research and let them lead the research and ask the questions they think need to be asked, and work with them to co-design what our research should be. And that project is particularly focused on people's experiences in relation to digital technologies that have been introduced to respond to COVID-19 and that increasingly mediate their interactions with the healthcare system. So I'd be more than happy to share more details about that as and when we have them with Nisha, with you via Nisha and her colleagues. But it's very much just about to go into field work, so we don't have a huge amount to say just yet. And then lastly, but not least, we're increasing the work that we do around participation in policy and practice. So this is about trying to support policymakers and technology developers to use participatory practices in their own work. So it's not just about us doing these kinds of participatory projects and telling people what we found, but encouraging people to use them themselves, which I think is a really important part of the future of kind of responsible AI. And I introduced these 4 kind of types of work that we do in our public engagement and participatory research because they are an example of us putting into practice a suite of concepts that we've been developing around participatory data and AI. And so this isn't just kind of work that we do because we're interested in it. This is work that comes from a conceptual framework, which we set out in a report that we published last year. And I'd like to spend some time diving into this conceptual framework because, again, returning to this central question of whose ethics do we talk about, I think the questions of participation are really important to answering that. And I noticed that, you know, this is focusing on data stewardship, but I think many of the principles apply to questions of AI governance as well, partly because obviously, you know, AI is built upon data sets, but also because I think you could equally replace data stewardship with AI governance here. Many of the principles would also apply to participatory AI governance. So some hopefully broadly applicable concepts in here. But in any case, we described participatory data stewardship in this report as the responsible use, collection, and management of data in a participatory and rights preserving way. And this was a piece of work that was led by one of my former colleagues, Reema Patel. And she essentially in this report outlined a framework for doing participation in the stewardship of data. And this framework was in response to a virtuous feedback loop, as she described it, where essentially, if we start at the top of the circle, if we want there to be trustworthy data use and effective governance of data and the technologies built upon them, we want that, because that will give us fairer and more equitable outcomes in society. And we argue, and hopefully many of you agree, that fairer and more equitable outcomes in society are very much a precursor and a prerequisite for broader social welfare outcomes supported by data. So if we want all these things that are promised by the data gurus, if we want fantastic new medical diagnostics, and if we want to tackle climate change through better use of data, and if we want more efficient transport systems, if we want all these social welfare outcomes, we can only have them. They will only be successful if they're fair and equitable in our view. Obviously, those broader social welfare outcomes are a key part of ensuring that we have increased social license and active participation in the stewardship and governance of data. So a really clear example of this is you can kind of see how comfortable people are with the use of data and things like opting in and opting out to data being shared for medical research. So if people see that data use in medical research is having an equitable, fair benefit to people in society, they're more likely to be comfortable with consenting to data being used. If they feel, as many people do in today's world, that data is not being used responsibly, that the benefits aren't being equitably shared, that private companies are profiting through the exploitation of people's data, then that social license will decrease and people will not participate, and they will do things like not consent to their data being used. And I think there's various evidence over the past few years that points to this being the case. But if done well, if we have this increased social license, if we have social license, if we have more active participation in data stewardship, then that will lead to more representative, inclusive and proportionate uses of data. And that will then underpin where we started, trustworthy data use and effective governance. Now, I appreciate there's probably a lot more kind of conceptual underpinning beneath this kind of feedback loop that I haven't gone into here and won't take the time to go into, because I think I'd rather use the time to talk about other things. But one of the easiest ways to kind of help make this feedback loop, I think, more easily accessible as the first time you see it, is to think about the opposite feedback loop, which is where data is used irresponsibly, or data-driven technologies are used irresponsibly. They lead to inequitable outcomes that then causes harms to society. That means people become disenfranchised, distrustful of data and AI. They're not interested in participating it. They reject it, and that kind of then means people aren't participating and further fuels this kind of negative feedback loop. So we see a negative feedback loop that exists in society, and we want to see if there's a way to create a more positive feedback loop around the way that data-driven technologies and society are intertwined. Now, for us, a key component in enabling this positive feedback loop to happen is public participation. So the other thing that we put forward in this report is this framework that I mentioned for kind of doing participation in data stewardship. But as I mentioned, you could talk about this being in participation in almost any aspect of technology design. And those of you that are familiar with kind of public participation will recognize that we've drawn quite heavily on existing frameworks around public participation in this. So some of you may be familiar with a ladder of participation put forth by a kind of political scientist called Sherry Arnstein in the 60s, which kind of has these different levels of participation, and as you kind of climb the ladder, you increasingly empower people. And then there's also a quite well-known today spectrum from the International Association of Public Participation, which kind of sets out a similar spectrum of kind of different levels of doing participation, and as you move through the spectrum, you kind of increase the empowerment that people have. And what we've tried to do is take concepts like this and put them in the context of data stewardship, data governance, and broader technology governance. So you start at the top left, which is inform, which is essentially, you will technology developers and policymakers will keep people informed about how their data is being governed, and we see this as the bare minimum in terms of participation with data governance. And then you have these middle three layers: consult, involve, collaborate, which are all about having a bit more of a two-way dialogue with data subjects or people who have a stake in the use of data. And it's about kind of listening to people's perspectives, and increasingly, as you move through and consult, through to collaborate, increasingly giving sort of decision-making power or the ability to input or co-design data governance models. You give that over to people. And then the most kind of the fifth layer is empower, which is essentially where you hand over either decision-making power or kind of governance power to data subjects, to citizens, to people who are affected. Now, again, I appreciate there's a lot kind of crammed into this slide, but this one I will take the time to explain bit by bit. So if you'll kind of bear with me, I'll take each of these in turn and kind of give some examples of how inform, consult, involve, collaborate, and empower can look in practice. And what all this adds up to is a framework for public participation in data stewardship and AI governance. So starting with inform, as I mentioned, this is really just about kind of being transparent, essentially, and letting people be able to know about the governance and use of data. And an organization called Understanding Patient Data have done fantastic work on what transparency looks like, particularly when it comes to the use of patient data. And they kind of explain that, the bare minimums or the kind of core concept of being transparent about data use is explaining to people what data is being used, who by, why it's being used, and how it's looked after. But crucially, what a lot of their work has made clear to me is that transparency around data use, informing people around data use, is not an end in and of itself. It is a means to an end. And what it is a means to is ensuring that data use is checkable, accessible, auditable, scrutinizable, if that's a word. Scrutable might be the word. And essentially, it's not just enough to say, oh, we've told you how your data is being used, you should be happy now, but it's about informing people so that they can challenge maybe the way their data is being used, so that they can better understand why it's being used, so that they can correct data that is incorrect. And those of you that work with NHS data sets or medical records will know that correcting incorrect data is quite an important thing. So this is kind of the base level, is just keeping people informed about data use. For us is the kind of low level of participation, or the kind of the base level of participation. The next step up is consulting people about kind of data use and data-driven technologies. And for this, one example is a survey that, and surveys in general are an example of this, but one specific example is a survey we ran in 2019 at the Lovelace Institute, where we asked people in the UK for their attitudes in relation to the use of facial recognition technology. And we essentially consulted them on where they were comfortable with facial recognition technologies being used, or where they were less comfortable. And then we used the findings to share that with policymakers and try to get them to pay attention to what the public think and how that should be responded to. So this, in a sense, was we see as consulting, because although we were asking people for their opinion, we weren't exactly giving them a huge amount of empowerment to decide what should be done with the findings. So it was it definitely was us asking for people's views rather than just telling them information, but it isn't a huge amount of empowerment given over to the participants, in this case, the survey respondents. Next level up is involving people in kind of decisions and governance of digital technologies. And drawing another example from our own work, the Citizens Biometrics Council. So in 2020, we brought together 50 members of the public from across the UK, and they participated in over 60 hours of deliberative workshops. The picture in the bottom left, I think, was taken just before we went into the COVID lockdown. So it was the last workshop we had in person, and then the rest of it happened virtually. But essentially what we did with this project was we brought these members of the public together, and they were recruited to be a diverse cross-section of the UK public, and they were given information about biometric technologies. They were given access to experts. They were given lots and lots of time to discuss it with each other, ask questions of the experts, and ask us for more information about the topics they were concerned with. And then they ultimately came up with their own set of recommendations for what they think should happen to ensure that biometrics technologies are kind of socially acceptable. So the difference here, in my view, between the consulting of a survey and the involving of a public deliberation like this is, with a survey, we gathered people's views and then we drew conclusions from it. In this public dialogue, we involved people in not only giving them information about a topic, but we involved them in drawing their own conclusions from the discussions. And as hopefully is relatively self-explanatory, that's slightly more empowering than just being asked to respond to a survey. They're getting to draw conclusions, and then it's on us as an institute to put those conclusions forward to policymakers. The next level up is collaboration. And a really good example of this is a data charter that's been brought together by Camden Council. So for those that aren't familiar, Camden is a borough in North London. And last year, excuse me, they were developing a policy framework and a set of principles to guide how they use the data that they hold. And to develop this framework and the principles, they worked with a panel of residents. And those residents essentially co-designed those principles and co-designed that framework with the council. And so it was a really good example of not just asking the people what they think the charter should look like, but saying, here you go, please draft the charter with us. And I was involved in this project a little bit in a kind of external way. And it was really interesting to me to see how the council really were keen to say, you know, this data that we're collecting, because we're a local council, is about our residents. So they really should have a say in how we use it. I think it's too early to say what the outcomes of this have been. They've only just started to kind of, I think they've only just finalized and started to implement the principles from the charter, but I think it's a really good step in the right direction. And then lastly, but not least, empowering. And I will be honest, there aren't a huge amount of examples I think that exist yet that truly empower people to make decisions about how data is used and governed and how technologies are built and designed. One example is this thing called the Open Humans Initiative, which is, I think, out of the United States, but I might be wrong. But in any case, it's a sort of, well, it's a data institution, I suppose, which is an emerging term, but essentially participants can decide which organizations they donate their data to conduct research with. So they get to kind of look at the different research projects, look at the different organizations interested in using data, and ultimately say, this organization, I'm comfortable with using my data for this research project, this one, I'm not. And so they're empowered to make decisions about how their data is used and what for. I'll admit it's not full empowerment. They're not starting the research questions themselves. They're not conducting the research questions, but it's a good step in the right direction. And these kinds of things are, as I mentioned, data institutions, and there's some really good work done by the Open Data Institute on what these data institutions look like. And there's all these kind of novel systems, structures, organizations for governing and using data, and many of them empower people in this way. But I want to be clear, not every data institution is fully empowering. Some data institutions are quite keen to empower people. So before I move on to talk about a couple of projects specifically and kind of turn towards the Q&A, just want to kind of wrap up that framework again. So what we see as, or what we have been thinking about as public participation in the stewardship of data, but as I say, also the governance of technologies, can kind of be broken down into this framework. And in the report, Participatory Data Stewardship, we spell out examples like the ones I've just run through in much more detail. And we also kind of look a little bit more about some of the different methodologies that might fall into these categories. The last thing I'll say on this spectrum is that these aren't discrete categories necessarily. So a project or an initiative might sit across multiple categories. It might move through different categories, and that we shouldn't, I don't want to imply that there are like hard and fast barriers between empower and collaborate, or between collaborate and involve, but it's much more fluid, and different projects can work in different ways. And crucially, because this is relatively nascent, relatively emerging, I don't think we could possibly say that there is like a good cookie cutter example of how to do any of these parts of the spectrum, or indeed that there is a one size fits all methodology for any of these things. So I've talked about surveys and public dialogue and things, but I don't want to imply that those are the only ways to do any of the kind of aspects of this spectrum of participation. So kind of on the home straight now, a couple of projects that I just wanted to talk about in a little bit more detail to kind of elaborate on some of the points that I've made, and maybe introduce some new ones that are of interest. The first is a public dialogue on the use of location data. So last year, the Geospatial Commission, which is a government body, commissioned a public dialogue on the ethical and trustworthy use of location data. Involved 85 people from across the UK. Again, broadly demographically diverse, not necessarily representative, too small a sample to be representative, but very much diverse. They took part in 4 online workshops on good old Zoom, which was a total around 25 hours in total. And they also conducted some participant led research which involved them kind of interviewing and surveying some of their family members. And there were also 7 specialist presentations featuring someone called Jeremy, who I realized this is a slide from another deck where Jeremy was in the audience, so ignore that bit, sorry, but there were 7 specialist presentations that kind of spoke to the members of this dialogue. And throughout their workshops, they kind of considered all the evidence they heard and basically shared their views on what they thought constituted ethical and trustworthy use of location data. And the findings were really, really interesting. I mean, in some ways, they echo what we often find in public dialogue around data. In other ways, they were really unique. We reported them broadly across these 4 categories. So firstly, awareness and understanding, which is really that we were focused on location data in this topic. That was the focus of the dialogue. But although people were kind of aware that location data is kind of collected via GPS on your phone and things, they didn't want to talk about location data and they didn't want to understand it simply as location data. They wanted to talk about the kind of technological ecosystem in which we live today. So it wasn't enough to just talk about the location data that your phone collects, but the apps that are on your phone and the people that design them and the technologies that underpin them. And so people really saw kind of data as they intuitively, even if they didn't recognize it, really intuitively kind of saw that you can't talk about kind of location data without talking about the kind of broader digital and technological society in which we live, which I thought was really interesting. And even when we tried to kind of extricate those 2 things, people were really keen to kind of talk more broadly. People were really insecure. They felt that data is being collected out there by these big organizations and they have no control over it. They felt really disempowered about how data is collected in the world in which we live and how technologies are built upon that data. So kind of, if ever more evidence was needed that kind of empowering people through participation was important, this dialogue showed it. They were really keen to talk about accountability, agency, and governance. These questions of how do we hold people that gather data, people that build technologies using data, how do we hold them to account? How do we ensure data subjects have more agency in this digital world in which we live? And how do we ensure these technologies are governed well? That was a really big concern for many of these participants. And lastly, one of the things we found was that people felt that there's an increasing reliance across society on data-driven systems, and they kind of questioned that. No one used the terms technological determinism, but it was this concept of technological determinism, this idea that technology is coming, it is the only way to kind of make decisions, and it's inevitable that we will increasingly digitize our worlds. That was a really kind of big topic for conversation, and many people pushed back on that and said, actually, are there more analog ways to kind of run our society? And then one of the things that came out of the dialogue was this vision for ethical and trustworthy location data use. But again, kind of one of the themes that I keep coming back to in this talk is that you could replace location data use, I think, with AI governance or data-driven technology. These concepts, when you're talking about public participation in them, they're very hard to pin down in very detailed ways, and people are really more interested in digital systems more broadly. But I won't dwell on this slide for too long, but I'll just make the point on this first point that came out in the vision for ethical and trustworthy location data use, which is that how data is used and who benefits are really, really key in considering whether it's ethical and trustworthy. So the most important question one of the most important questions that came through this dialogue when you're talking about, is that use of location data ethical? Is it trustworthy? It wasn't so much about privacy or power or any of those one things individually. It was, are the people that are going to benefit from this data use the general public, or is it a government or an organization, a private organization? Because that really was the starting point for many people in terms of where their concern around things like privacy and transparency and accountability all fell out. It came back to, are the intentions of the people gathering and using these these data sets, are they aligned with what I, as a citizen, would think is good? So I will just kind of briefly talk about one final project, and then I would really love to kind of hear your questions and thoughts. And this final project is algorithmic impact assessments, and I put participatory on the front of it because participation is a key component of it. So kind of over the last 6-12 months or so, my colleagues have been working with NHS X to kind of develop a process for assessing possible societal impacts of an algorithmic system before that system is in use. So this is responding to kind of the fact that policymakers, AI developers and researchers at the moment are really interested in algorithmic impact assessments, but there's very little work. There's very little evidence, on how they work in practice. So in other words, if we're developing an algorithm, and if that algorithm is going to be used in a context that has social implications, and that's almost every context, I suppose, how can we assess what the impact, positive or negative, of that algorithm might be before we deploy it? So kind of trying to avoid many of the pitfalls of recent years where an algorithm is deployed and all of a sudden students are protesting because it's given them the wrong grade, or it turns out that it's giving really biased medical advice. How can we try and predict those impacts before it's deployed, and then indeed design them out? So the process kind of has 7 steps. Essentially, the nuts and bolts of it is that the NHS have these big data sets that they want to allow researchers to run algorithms on and try and develop algorithms for. And before those research teams can get access to the data sets, they need to, 1, do a reflexive exercise where they themselves essentially perform a risk assessment on their algorithm and try and work out what the positive or harmful impacts might be. Those applications are then filtered and a handful are selected to progress to then a participatory workshop. And so this will be a panel of patients who will review those, review the kind of applications, review the potential impacts, and try and identify other impacts based on their own lived experience. That will all be synthesized, and then a data access decision will be made. And the research team can then kind of start going and doing their work with the data sets. But crucially, the impact assessment is then published and publicly available, and it's iterated on. So it's not just a tech box exercise, it's a living document. And I just want to pull out, for the purposes of this talk, I want to pull out that 3rd stage, the participatory workshop. So as I say, what we've proposed to NHS is that they set up a panel of patients and kind of wider members of the public. I appreciate patient and member of the public are kind of one and the same thing, but anyway, people that have lived experience of interactions with the healthcare system will sit on a panel, and that panel will review the applications from the research teams that are trying to deploy algorithms on the data sets, and they will be given support to kind of understand what the algorithms are trying to do, to understand some of the kind of ethical implications, and kind of basically given the information and support they need to interrogate those applications thoroughly. And then the outcomes of the the patient panel will inform data access decisions. So I kind of bring this example in as, in my view, if we go back to that spectrum, this is probably at the level of collaborate on that spectrum, where you are essentially setting up, or NHS is setting up an innovation pipeline, but they're embedding into it a really key moment of participation, which in my view will help ensure that the AI algorithms that run on these data sets and are developed through them are governed in a way which is strengthened through the participation of members of the public, bringing their lived experience, bringing their own values, their own ethics. So a really good example, in my view, of putting some of the concepts I've kind of talked about over the last half hour or so into practice. And the hope is that this will get piloted and put into practice soon. So hopefully, if ever I get the chance to chat with some of you again in future, I can say how this actually worked in practice. At the moment, it's just a concept we've put forward. So I think that is my last slides. To recap, I told you a little bit about the Aidan Lovelace Institute. I told you about kind of the concepts of public participation in data AI and that spectrum of participation and what it looks like. And then a couple of examples in more detail of how participation can look in practice. Thank you so much for listening. I will stop my screen share, and I'd really welcome your questions, thoughts, comments, ideas, and so on.
Great, thanks, Aidan. That was really interesting and covered a lot of ground, actually. As always, people can either turn on their cameras and just raise your hand if you want to ask a question, or you can type the question in the chat and I will read it out for the speaker. While we give people a chance to do that, I'm going to lead off a little bit and abuse my chair's position, and I just want to ask you really about. So I mean, I think a lot of the stuff that you're doing around, participation and deliberations is is really great stuff. One of the things that I've been thinking about, and that we and Helix have been thinking about, is what are the mechanisms to to incorporate deliberations and of those other types of exercises actually into a governance framework to give them some bite. I don't know whether you wanted to say anything about that.
Yeah, no, it's a great question, and kind of, as I say, I think one of the I guess it's one of the open questions really is there's a lot of good work on how to do participation, the question of like policy making, for example, but embedding it actually in governance mechanisms is quite difficult for all kinds of reasons. Some of them are very practical, like these things are resource intensive, and one of the challenges we found, especially when we developed that AIA process with NHS, was that the kind of more robust we wanted to make the participation, the more barriers that put to developers who wanted to kind of get access to the data set, and also to the NHS being able to implement it. So finding ways to take the kind of best practice gold standards of participation and embed them in governance frameworks is going to face some practical hurdles, and I think the work is yet to be done to kind of figure those out. So sorry that the answer's a bit, need to do more research, but hopefully that's an answer that many people on this call are familiar with hearing.
Thanks. So I can see we've got lots of people with hands up. I'm going to try and fit everybody in. I'm not sure who was first. I think possibly Rob Lawrence. If you want to if you want to ask your question.
Yeah, sure. Just a quick one, Aidan. That's really interesting. A number of things come to mind, one of which is the transparency, I think, is perhaps key to everything. Because if you have transparency, then there are quite a few people in the public domain who will be on the case. If you don't have transparency, and in other words, there's a sort of almost, I don't know, quite a strong technical group of people that are looking out for this. And if there's transparency, I think that raises the issues very clearly. If there's no transparency, you've lost an awful lot of your public participation, and often it's quite skillful and quite technical. Another thing that was particularly interesting was AIA. I love that idea, although it's very interesting to hear that there are some practical problems with it. You're working with NHSX, I think. Have you thought about working with NIHR? Because they do a lot of vetting of AI type health data projects.
Oh, sorry.
No, that was basically the main question. Yeah, sorry.
Yeah, no. Two great questions. I'll take them in reverse order. One, which is to say, it was a couple of my colleagues who led on the overall AIA process. I just helped out with the participatory bit. I don't know if or how NIHR have been involved, but I know that part of the reason we worked with NHSX was because it was they were really keen to give us a really kind of clear case study around which we could build a process to put into practice. And sure, if my colleagues had the chance to kind of work with others to think about how some of those principles might be applied in other contexts, they'd be really interested to do that. So I will take that back to them and see if NIHR are people that they've worked with.
Can I just say that only 3 weeks ago I was involved with, as a public patient participant, with an application to NIHR, which was quite fascinating. It involved a presentation that lasted half an hour of this project, which was using patient data, EPR, and was AI related. And that was a massive hole that actually hadn't occurred to me at the time. There was nothing, I mean, I don't think there was anything wrong with the project proposed from that perspective, but it clearly didn't involve any, as far as I could tell, any AIA in the selection process. So I think they profess to champion public participation and patient participation, NIHR do. And in fact, they insist that projects applying for their funding meet those criteria. But I think they may have missed a trick there. I'll shut up because lots of other questions coming up.
That's really great though, thank you. And as I say, I'll check in with my colleagues, and if they're not already chatting with NIHR, I'll encourage them to do so. I'll just make one very brief point on transparency, which is you're exactly right, that transparency is key. And I'll admit I did skirt over many important topics like transparency, but there's some really interesting work the Centre for Data Ethics and Innovation did, which found that people see two levels of transparency as quite important. So one level of transparency is the level of transparency that data subjects themselves want to know, the kind of the who, the what, the why, the how that I mentioned before. The other level of transparency that they want is technical detail to be available, but not for themselves, for the experts that you say exist out there, the journalists and the technology developers and the data privacy advocates, who people want to kind of trust that they will be out there in the ecosystem, keeping an eye on the uses of data and ensuring that they're responsible. So that, as I say, that piece of work was by the Centre for Data Ethics and Innovation. I'll see if I can dig up a link and share, because I think it's a fascinating piece of work.
Thanks, thanks, Aidan. So I'm reduced to working my way along the top of my screen here. So Allison Hall, I think you were probably the next person, and then so I will try and get to everybody. But Alison, if you
thank you. I'm not sure I was next. I think Michael might have been before me, but anyway, I'll ask my question anyway. Great presentation. Thank you very much, Aidan. I wanted to ask you a bit more about framing slide 13 in particular in terms of your data, because as a lawyer, you know, I think that the use of your data implies some relationship or some control over that data, and then I'm, you know, immediately sort of want to ask you questions about, is it just identifying or identifiable patient data that you're talking about here, or anonymized data? So I wonder whether you could say a bit more in relation to that, please.
No, it's a really, really fair critique. Also, hi, it's really, really nice to see you again, Alison. Really, really fair critique. And actually, if I could go back and change one thing about the framework, it was that we would mention data about you. And this is, again, falling out of the really great work from folks like Understanding Patient Data that recognize that your data is a misnomer and it's inaccurate for all the reasons that you mentioned and more. And actually, what we're really talking about is data in which an individual has a stake, either because the data is about them. Now, they might not have any control over it. They might not own the servers on which it sits. They might not have even collected it. I don't collect the data that Facebook has about me. I have no ownership relationship to that data other than the fact that it's about me. So on the one hand, you have a stake in it because it's about you, or because the data is used in a way that affects you. And actually, this is something that came up again in some of my colleagues' work on the EU AI Act, where I think the term end user is kind of being suggested as referring to these stakeholders, right, in people that are affected by AI. Now, I'm not sure end user is the right term, but really there's still an open question around what is the right term to describe people that have a stake in data and data-driven technologies. And I completely agree with you. Your data is the wrong terminology. And as I say, if I could rewrite the report, that's one of the things I would rewrite on it. So yeah, thank you.
Thanks, Aidan. Mike Burgess, would you like to?
Yes, thank you. Great presentation, Aidan. Very fascinating set of projects. I just wondered if you could say 20 words or so about how you go about structuring your mini publics or the panels for governance, just in the sense of anticipating one of the chat questions. You know, how do we represent marginalized people who often, if we just did a representative sample of the population, would disappear?
I will do my best to stick to 20 words, but I could talk about this all day long. It's a really important part of designing these things. So yeah, thanks for picking up on it. I kind of mentioned briefly that in my, you know, you cannot seek statistical representation in kind of mini publics, and nor should you, because that's not effective. Instead, what you should seek to do is bring as diverse a range of perspectives into the room as possible. And for me, what that means is trying to get a good spread of demographic diversity of the population that you are engaging with, of the public that you're engaging with, but also recognizing that for a particular topic, there are going to be particular effects for certain communities or disproportionate burdens for certain communities, and you need to overrepresent them in the debate. And this is for two reasons. One is because if you don't overrepresent them in a room, you know, you will lose that and you won't have meaningful inclusion. But it's also because there's a really kind of good set of kind of, I guess, political science research that looks at kind of like, you know, the notion of the wisdom of the crowd, and how, you know, having X many different perspectives in a conversation will avoid things like groupthink and all that kind of thing. So there are some really important methodological questions around how you build that diversity into a project. But for us, what it means is, for a specific example, in our biometrics council, we recognize that biometric technologies have disproportionate burdens or disproportionate harmful impacts on people in this country, on people who are from ethnic minorities, on people who are from the LGBTQ community, and people who are disabled. So we conducted 3 separate mini dialogues with each of those communities, and then we also overrepresented each of those communities on the main dialogue. And in the report, you can see issues that come through clear as day, thanks to the involvement of those communities. And it wasn't just those participants talking about it, but it was the fact that those perspectives were in the dialogue, that the whole council considered it. So yeah, really, really fascinating kind of thing is, how do you structure these dialogues? And yeah, I'm sure we could talk for hours about it.
Great response, thank you.
Thanks. So Ashleigh K, sorry, apologies if I pronounced that wrong, but
I think that's the first time someone's pronounced my full name correctly, actually, so thank you, Michael. Thank you so much, Aidan. I really enjoyed that. It was fantastic. So I work on employment and technology, and at the moment I'm looking at how algorithmic impact assessments could be useful in the employment context. And I'm looking at kind of 2 levels, like in the firm level and then kind of at the developer, like vendor level, because a lot of the technologies used in the employment context are sold by big, normally US-based companies. And at the firm level, we have quite a lot of literature already on how employee representatives can be involved, particularly in countries like Germany and Austria, where they have sort of thing called co-determination, which means that the employees' reps are actually involved. But I'm not so sure how it would work at the kind of vendor level. And I know that a lot of what you're talking about is more like public bodies doing these kind of impact assessments. And I'm just wondering if you have any thoughts on how that could translate to kind of private bodies selling a tool and then doing an impact assessment of that, because we've seen some like technical standards like in the AI Act, but it seems like this is something that requires really like a more holistic analysis.
It's a really great question. I'll pop my email into the chat for anyone to get in touch, but particularly you should drop me an email and I can connect you with my colleagues that will probably
thank you,
talk
that'd be
about this in more depth. But a first stab at one of the things, so as we developed this AIA process, we did engage with some private software companies that will want to be pitching for access to the data sets. And I wasn't involved in all of the conversations, but I was involved in the participatory bits. And one of the challenges we found for them was making them kind of see the commercial benefit in putting time into running a participatory process. So we had to work out, and it was a good challenge for us, what is the value to a private organization, to a profit-making company developing software, in them putting time, capacity, and resource into it. Now, obviously, many of them will be familiar with doing things like UX research, but that's a very different type of engagement to what we're describing. It's much more downstream. It's beta testing, prototyped products. It's not doing it very early on to understand what the kind of impacts might be. And we had some really interesting discussions. I don't know that I've got any kind of concrete answers, but thank you, Imogen, for popping my email in the chat. Yeah, as I say, drop me a note and I'll put you in touch with my colleagues who know more about this than I do.
Thank you so much.
Thanks. So I can see there's one more question from Jamie Webb, but I also Jamie, I do want to give you a chance to ask that, but I just also want to read a question that Katerina put in the chat. So Katerina says, I want to ask you 2 technical questions. What techniques can you use to involve marginalized people in deliberations so that their voice is also heard? For example, people with low socioeconomic status. And I think you've addressed a bit of that when you were replying to Mike, but also what happens if people express offensive or extreme viewpoints during deliberation? And are there any real world examples of how you can resolve tensions between multiple viewpoints?
Yeah, two really, really fantastic questions. On the first one, yeah, I mentioned a couple of things already, but I guess practically speaking, when you are involving marginalized people, it's really important that you kind of make sure that, I guess actually, let me rewind slightly. The answer to both of these questions in one is expert facilitation. So we work with people who are kind of professionals in running dialogues. And the reason it's so important for that first bit in terms of how do you involve marginalized people, it's because expert facilitators should know how to kind of work with communities that where there might be sensitivities about their engagement, where they might be kind of historically oppressed in kind of public forums, and making sure that the space and time and support is given over to them, but also that their needs are accounted for. So for example, in the location data dialogue, it was really important to us to include digitally excluded people. It's particularly difficult doing that considering we were running dialogue on Zoom. So the facilitators did a fantastic job in whatever materials were produced for the participants that were generally emailed to them. All those materials were sent in the post to the participants. They were given phones so that they could dial in. Those of us that I was a facilitator for one of the groups, and we had kind of extra things in our guides to make sure we were bringing in the people that weren't engaging via a screen but engaging via the phone. So building that extra support is really, really crucial. And on the second point, yeah, it's a challenge. I mean, I've been fortunate that I've not had any, I would say, offensive viewpoints that come up in any of my dialogues, but I guess the more of them I do, the more chance war might crop up. But we did have in one of our dialogues about COVID technology, somebody really pushing some misinformation, and it was really challenging because what do you do with that? And the facilitator was really fantastic in basically essentially recognizing that that was that person's perspective, and that their perspective needed to be recognized and acknowledged, but it didn't need to dominate. And so they were really expert in kind of giving the time to that person to air their views, but ensuring that that wasn't the view that led the conversation, if that makes sense. And also, it's really important to build in things like mechanisms so that if anybody does feel, uncomfortable or indeed offended, they can take a timeout or they can raise an issue and we can have a conversation with the participant. I mean, I guess in an extreme case, if someone was offensive to the point of being disruptive, and it was harmful and it was kind of really negatively impacting upon the other participants, I think we would have to make a decision to remove a person like that from a dialogue. So there are those options as well. But yeah, great questions, and they're ones that are ongoing questions we have to grapple with when we do these kinds of dialogues.
Thanks, Aidan. So if you're happy to stay on to answer one more question, I think Jamie has been waiting really patiently. So if you would like to ask your question.
Thanks so much, Michael. Thank you, Aidan, for such a really wonderful presentation. I'll try and keep it brief. I was just really struck by what you mentioned about in the location data discussion dialogues, the desire for participants to think more broadly than maybe just the confines of the question being set. And then I was kind of interested in the contrast with the algorithmic impact assessment, where I'd imagine, I haven't actually read that report yet, but I'd imagine it was more focused on a kind of particular use technologies. And I guess that was my question was, how specific is it possible for these dialogues to be in terms of how kind of into the weeds of a particular technology or a particular application do participants, want to discuss at? Or is it they go to those more sort of broad, high-level questions? I mean, just very quickly, example, lots of discussion about like explainable AI and the kind of explanations that a particular technology might be able to provide. And you might think, well, we could have a dialogue on like a particular technology, which particular explanations people might think are valuable to be provided by it. And I was wondering if you thought, is that kind of possible? Or does the questions go more high level? As I say, how specific into the weeds can these dialogues be?
It's a great challenge and a great question, and again, I think one that has to be grappled with whenever these things are designed. I guess my kind of hunch of a response, and forgive me because I'm probably going to be thinking it through out loud as I go, but it's that the dialogue will probably inevitably almost always be broad. Now, good facilitation can kind of bring it back on topic. If you're talking about biometrics or location data and someone starts talking about something else, a good facilitator will know, is this a tangent that's irrelevant, and bring it back on topic. But sometimes it might be a tangent. Someone might be talking about something that's not location data, but it is about privacy and intruding technologies. That's a useful tangent. So my hunch is that the dialogue is always going to be broad, and that should always be welcomed, but the conclusions can be narrow and focused. So in the location data dialogue, we didn't necessarily ask the participants to kind of draw their own conclusions, but in many other mini publics and public deliberations, you do ask them to come up with a set of recommendations and conclusions. I think that's the bit where you can get more specific and more in the detail. Now, there are always limits on the depth kind of technical expertise you can get to, because you can't make someone a 10-year expert in something in the 3 months you're working with them. So I think there is always a level where you're kind of maybe not in the technical weeds, but you're at the level of kind of values or principles. And then it's up to the expert policymakers or technology developers to interpret that in the right way. So again, quick example, the Biometrics Council said they want better standards for the development and deployment of biometrics, and they set out some of the categories these standards should hit, like equality, accuracy, effectiveness, but they very much recognize themselves, but it's up to the technical experts to work out how these standards should look in practice. Yeah, apologies for running over, everyone. Thank you so much for staying and indulging me.
No, that's brilliant, Aidan. Thank you. And yeah, thanks everyone for coming along and for asking great questions. I think that was a really excellent talk. So yeah, people would just like to join me in giving a round of applause. It may be virtual applause, but by all means, I'll try and do a bit of both, just to make it, just so you can hear something. But yes.
That's very kind. Thank you so much. And yeah, it really my pleasure to come and chat. And you know, for me, the mark of doing one of these things is that you get lots of engaging questions. So thank you so much. And yeah, my email's in the chat. Please do get in touch if you want to pick up any of the conversations. I'm always more than happy to chat or put you in touch with colleagues.
That's very kind. I've had quite a few requests for your email, so I'm very pleased that you answered that question before I asked it. I will send that to some who couldn't make it today, so I'll send that out. Thank you.
I think you can go ahead and stop the recording. So yeah, thanks everyone. That's brilliant. Yeah, hopefully this will be